nice summer day, an old couple was on their annual road trip when the man noticed something was wrong with his wife. She claimed she felt ill, but had no idea why. She was persistent in continuing on until she no longer couldn't. Her husband panicked and called 911 as she puked and looked up at him, her mouth slightly drooping. The medics arrived, but the woman refused help. Her husband didn't pressure her into going, but by then it was already too late. The stroke had done its damage. It would later be the cause of my grandmother's death after 5 months in a convalescent home. Her death led me to find out as much as I could about what caused her to be the way that she was. I saw the effects of an ischemic stroke on my grandmother, and I learned it was something that could happen randomly to anybody. I am a pre-nursing student, and I will learn about multiple diseases so I can help my future patients. Today I will tell you about ischemic strokes. Ischemic strokes are more common than some may think. It can happen to anybody. The faster it is recognized, the less damage it will cause. Understanding and knowing the causes and symptoms of a stroke can one day help you save a life. The cerebrovascular disease, ischemic strokes, have specific causes, identifiable symptoms, can be treated and prevented. Let's begin with what it is. Ischemic strokes are a cerebrovascular disease. They prevent oxygen from reaching the brain and cause brain cells to die. This prevents brain tissue from receiving oxygen. Ischemic strokes occur when blood vessels in the brain are narrowed. On the National Institute of Neurological Disorders and Stroke website, it was described that plaque buildup or clots in blood vessels prevent oxygen from reaching the brain. When blood vessels are narrow, it prevents blood from going to the brain. Blocked blood vessels also cause ischemic strokes. It was explained in an article about atherosclerosis on the Cleveland Clinic website that plaque buildup in arteries narrows blood vessels. Oftentimes, people are unaware of the buildup until a medical emergency occurs, like an ischemic stroke. Blood clots formed in the heart and neck can also interrupt the oxygen pathway to the brain. Ischemic strokes cause brain cells to die. Without oxygen, brain cells die within minutes. It was stated on the American Heart Association website that a lack of oxygen prevents neurons from functioning, leading to cell death during an ischemic stroke. When brain cells die, they no longer have the opportunity to regenerate themselves. The severity of brain damage relies on how long the brain is deprived of oxygen. On the Johns Hopkins website, it was suggested that certain areas of the brain that are targeted by an ischemic stroke may lose function when oxygen is not received. This results in long-term brain damage. Critical functions of the brain are lost in the absence of oxygen. Ischemic strokes prevent brain tissue from receiving oxygen, and they also cause brain cells to die. Next, let's see how this happens. Ischemic strokes have specific causes, including fatty deposits and blood clots in the stream. Ischemic strokes are caused by the buildup of fatty deposits. These fatty deposits are formed when excess plaque builds up in blood vessels. Plaque accumulation of cholesterol and fat are what cause arteries to narrow. And when arteries become very narrow, the blood to the brain is reduced. On the American Stroke Association website, in an article about arterial damage effects on strokes, it was reported that sometimes fatty deposits in blood vessels can burst, causing blood clots to form. These blood clots formed from excess plaque can grow and begin to reduce blood flow to the brain, triggering an ischemic stroke. Blood clots travel through the bloodstream, trigger ischemic strokes. Two types of ischemic strokes are caused by blood clots. The first kind is known as a thrombotic stroke, where the blood clot is formed in the brain artery and travels in the brain. Embolic strokes occur when a blood clot is formed in a different part of the body and eventually makes its way to the brain. On the University of California, Los Angeles website, it was suggested that it is very common for blood clots to leave behind fragments when removed. These fragments can travel through the bloodstream and lodge themselves into a new artery, possibly triggering another stroke. Ischemic strokes can be caused by the buildup of fatty deposits. Blood clots that travel through the bloodstream may trigger an ischemic stroke. Now let's look at how it is identifiable. Ischemic strokes have identifiable symptoms, including facial weakness, difficulty speaking, paralysis, and blurry vision that can be identified using the FAST method. People experiencing an ischemic stroke can have facial weakness. The lower part of the face will show signs of weakness, which is very prominent. Ischemic stroke patients may experience facial drooping or the difficulty with forming a symmetrical smile. The cheek muscle loses its strength during an ischemic stroke. It will cause the person to find it difficult to fully close their mouth, and the patient will sound unclear when they speak because their face is immobile. Those having an ischemic stroke may also have difficulty speaking. My grandmother was unable to form coherent sentences. She experienced slurred speech, and she struggled to pronounce her words clearly. Ischemic strokes also cause the muscles in the mouth to weaken. Speech can become distorted, which makes it difficult to articulate, and ischemic stroke patients lack muscle strength in their tongue and cheek. An ischemic stroke can cause paralysis in the limbs. Paralysis can occur on one side of the body, which is usually the side opposite of where the stroke occurred in the brain. My grandmother experienced a stroke on the left side of her brain, so she experienced right side paralysis. An ischemic stroke can lead to permanent paralysis. Paralysis limits patients' ability to use limbs. My grandmother's right hand began to curl up over time from lack of use, and my grandmother could not walk properly, which left her in a wheelchair for her remaining time. Ischemic stroke patients also may seek rehabilitation recovery, although full recovery is not possible. Blurry vision can also occur when having an ischemic stroke. The location of the brain is what influences how the stroke affects the eyes. Ischemic strokes can either cause partial vision loss or complete vision loss, or it can affect peripheral vision, which makes it difficult for people to see from the side. Blurry vision during an ischemic stroke is often sudden and painless. Patients dismiss symptoms due to the normal feeling of strain, and vision can be dimmed during an ischemic stroke. Ischemic strokes can easily be identified using the FAST method. FAST is an acronym for face, arms, speech, and time. F stands for checking facial drooping. First, instruct the patient to smile, and which their mouth may droop. Facial droop may be noticed even through an uneven cheek. A involves checking arms for weakness. An arm falling back down when raised in the air could be a sign, or the patient may be unable to move their arms at all. S refers to speech. The person may form incoherent sentences, or their speech sounds slurred even if they think they sound normal. T means time. Brain damage can be reduced the faster help is received. Immediate help can make an ischemic stroke less life-threatening. It was reported on the Kaiser Permanente website that 69-year-old Bob Wilms began experiencing signs of a stroke, including blurry vision and facial numbness. His wife was able to recognize these signs using the FAST method and immediately drove him to the hospital for treatment. Her knowledge of the FAST method led her husband to receiving an immediate diagnosis and treatment, allowing him to survive in a healthy state. People experiencing an ischemic stroke may demonstrate facial weakness and have difficulty speaking. An ischemic stroke can cause paralysis in the limbs. Blurry vision can occur when having an ischemic stroke, and it can be quickly identified using the FAST method. Fortunately, there is help. Ischemic strokes can be treated. With immediate response, emergency endovascular procedures and open artery surgeries may be options. Immediate treatment lessens the damage of the stroke. In an article about the importance of immediate stroke treatment on the Thomas Jefferson University Hospital website, it was estimated that approximately 1.9 billion brain cells die every minute someone is having a stroke. And the longer someone experiences a stroke, untreated, the higher the risk of disability or death. Every second counts. My grandma had symptoms of a stroke for about 10 hours before she received help. She dismissed her symptoms, believing they were from the heat, and when she was taken to the hospital, the damage had already been done and they couldn't do much to help her. Emergency endovascular procedures may be used to treat an ischemic stroke. Doctors will place a catheter into the brain to remove the blood clot. The catheter will grab the blood clot and help restore the blood flow to the brain. This method works best within 6 hours of having symptoms. Some ischemic stroke patients may undergo endovascular procedures. Imaging is often used to determine if this is the most beneficial route to help the patient, and eligibility depends on the clot location. An ischemic stroke can be treated with open artery surgeries. Surgery may be conducted to remove plaque located in the arteries. This is done by accessing clogged arteries through the neck, and plaque removal often helps prevent future strokes. It was reported in an article about successful endovascular treatments on the National Library of Medicine website that with the usage of a new stent device to remove blood clots, doctors have been able to unblock blood vessels with an 83% success rate. Immediate treatment may lessen the damage of an ischemic stroke. Emergency endovascular procedures may be conducted, and ischemic strokes can be treated with open artery surgeries. Finally, let's see how it can be avoided. Ischemic strokes can be prevented by maintaining a healthy lifestyle, controlling cholesterol, and monitoring blood pressure. Ischemic strokes may be prevented by maintaining a healthy lifestyle. Not smoking helps prevent stroke risk. Smoking often damages blood vessels and makes them more susceptible to clog. And quitting allows the body to repair the previous damage to the vessels. A healthy lifestyle involves managing risk factors. Vascular health can be maintained through monitoring blood sugar, and daily physical activity helps improve circulation. An ischemic stroke can be prevented by controlling cholesterol levels. High cholesterol is often caused by the buildup of plaque in arteries. When cholesterol can be lowered through medication, and there are certain cholesterol medications that are designed for stroke prevention. My grandmother suffered from high cholesterol, and she was prescribed cholesterol medication, which she didn't really use, and continued to eat whatever she liked, which kind of helped with her clogged arteries. Blood pressure can also be prevented by monitoring blood pressure daily. At home, blood pressure monitors can help manage levels every day. And blood pressure levels higher than 180 by 120 are stroke level. High levels require medical attention, and doctors will offer emergency medicine to lower blood pressure. Untreated high blood pressure can lead to artery damage. And blood pressures higher than 180 over 120 make it more difficult for the brain to function. Ischemic strokes can be prevented by stroke screenings. Doctors perform a stroke screening if the patient has a history of stroke risks. It is crucial if the patient has a family history of strokes, and the screenings often include blood tests and carotid ultrasounds. Screenings can also help catch an ischemic stroke before it occurs. Test results can lead to early intervention, and awareness may help improve preventive care. Ischemic strokes can be prevented by maintaining a healthy lifestyle and by controlling cholesterol levels. Controlling blood pressure by daily monitoring can help prevent ischemic strokes, along with receiving stroke screenings at regular checkups. Sometimes it's the smallest things that can change a life. Ischemic strokes are a cerebrovascular disease. This disease prevents brain tissue from receiving oxygen. Blood vessels can be too narrow, which prevents blood from passing through to the brain. Ischemic strokes can cause brain cells to die. The severity of brain damage increases the longer the brain is oxygen deprived. Ischemic strokes have specific causes. This disease can be caused by the buildup of fatty deposits, which are formed from excess plaque that blocks blood vessels. Blood clots that travel through the bloodstream may trigger an ischemic stroke. Two types of ischemic strokes are caused by blood clots. Ischemic strokes have identifiable symptoms. Those having an ischemic stroke may have difficulty speaking and paralysis in the limbs. They can be identified using the FAST method. Ischemic strokes can be treated. Immediate treatment may lessen the damage from this disease as every second counts. Emergency endovascular procedures may be conducted to treat an ischemic stroke. Ischemic strokes can be prevented. A stroke is more than a medical emergency. It's someone's life on the line. Every second counts, as a life can be changed in an instant. Nobody should have to say goodbye to their loved ones or watch them deteriorate because we couldn't notice the small signs. It is our awareness that can help us save lives and make every second matter.